Good evening, everyone. We thank you so very much for joining us on tonight. Let us have a word of prayer. Eternal God, our Father, we are thankful for this another day, for each person that has joined us on this evening, and for our presenter. We thank you, O God, for what you have allowed us to do for several years, allowing us to increase our knowledge, and for that we are thankful. Bless and keep us. In the name of Jesus Christ, we pray. Amen. On this evening, we have as our presenter, and I will have her give a few words in terms of introduction about herself, her background. But we have Miss Nikki Carrington, the owner and agent of Carrington Insurance LLC in Henrico County. And we thank all of you for joining, even as those who are still coming in. And Miss Carrington, it is all in your hands.
Well, thank you very much, Reverend Brown, and thank you to all of you all that are on the Zoom meeting today. It is a privilege and an honor that I have the opportunity to present to you today. This opportunity was really blessed. I had a chance to meet with one of my colleagues who is on the Zoom call tonight, Mrs. Yanit Govine, and she mentioned that she had the honor, privilege, and pleasure of meeting with Deacon and Mrs. King several months ago, and the opportunity was presented to enable us to speak with you all this evening. And I always believe that when God puts things into place, we have to act upon it. And so it's with great privilege that we are both here today. And I'd also like to thank Reverend Brown and his team for getting everything organized and allowing us this opportunity. So again, we're very blessed and grateful for the chance to speak with you all today. So what we will be doing, as you saw earlier, is doing a Medicare one-on-one overview. And I do have a presentation that I'm going to share with you all. Medicare is a topic that you can never know enough about. Whether you are a Medicare beneficiary or you are a family member of a Medicare beneficiary, there's always opportunity to learn. And so today you're going to learn. I will promise you that you will not be the expert on anything Medicare, but I can also commit that you will leave the meeting this evening with more knowledge than you had before. So hopefully that's fair enough. We'll also give you the opportunity at the end to ask questions so that this can be an engaging opportunity where you all will have all of the information, or at least a good portion of it, to help you along the way. So what I'm going to do before I go into everything is just give you a little bit more about my background. As Reverend Brown mentioned, I am the owner and managing partner of Carrington Insurance. We are a full service insurance agency where we assist folks with their Medicare needs, as well as life insurance and burial insurance. Our specialty is definitely Medicare, where we help Medicare beneficiaries navigate the complexities of Medicare and provide them with the knowledge and information, as well as tools that they need in order to make a sound decision in regards to their needs. We began our agency in 2020, right at the height of the pandemic. Prior to that, I had over 20 plus years of experience in the insurance and financial service industry, where my most recent opportunity was being the director of Medicare sales for Anthem Blue Cross and Blue Shield for the entire state of Virginia. And I was in that role for several years, which gave me an opportunity to become more engaged with Medicare and learn more about the ins and outs and those complexities that Medicare beneficiaries face. So today I am going to be able to share that knowledge with you. I decided to leave corporate America back in 2020 because when God says move, you have to move. And it was time to work in the industry in the way that he wanted me to work. So that's why I'm here today. So without further ado, I'm going to share my screen. And if you could let me know if you can see the screen. I'm going to stop my video so that I can concentrate on the presentation. But if I could get a thumbs up or anything.
Yes, you're
Perfect.
good. Getting started with Medicare.
That's it. Wonderful. So we're right where we need to be. I won't be able to see the chat while I present. However, please feel free to take notes and also comment in the chat with any questions that you have, because at the end, we will definitely address those specific questions. So please feel free to engage in the chat. We do ask that you save the questions for the end, just simply because a lot of what you might have questions about will certainly be addressed in the presentation. So as we look at Medicare, there's a few things that we are going to cover today. One is what Medicare is. We'll take a look at the different options that a Medicare beneficiary would have with original Medicare. We'll take a look at Medicare supplements, also known as Medigap plans. And then we'll also dive into Part D prescription drug coverage, as well as Medicare Advantage prescription drug plans. There's also help and resources available for people with limited income or resources. And so we'll look into those opportunities, and then we'll open it up for questions. So getting started with Medicare. First lesson that we're going to go over today is what Medicare is. And many people identify Medicare as being health insurance, which it is. It's designed for folks that are 65 and older. Also, folks that are under 65 that have certain disabilities. And some of those disabilities are the ALS, also known as Lou Gehrig's disease, and folks that have that or end-stage renal disease are able to become eligible for Medicare without a waiting period. And in order to get Medicare, you must be a United States citizen or lawfully present in the US, and you have to reside in the US for 5 continuous years. Anyone that's a Medicare beneficiary or have family members of Medicare beneficiaries, you may have seen this booklet. It's called the Medicare and You book that comes out every single year. And it's something that most people don't look at. It collects dust, sits on that end table in the living room, but it is a really important document. And the reason why it's important is because changes that occur with Medicare are going to be listed in this booklet. So I do implore you, if you receive that every year, to hold on to it, take a look at it. If there's new Medicare plan options from year to year, you'll see that in the back of your book. That book is designated for your specific zip code. So you'll also see the health plans that are available in your area when you have the Medicare and You book. Enrollment into Medicare. Enrollment into Medicare is automatic for some people, and that is for those that are already receiving their Social Security benefits or their railroad retiree benefits. And when you are automatically eligible for Medicare, you want to look for that Get Ready for Medicare package. It gets mailed to you 3 months before the month that you turn 65. And then for those that are disabled, it's the 25th month of their disability benefits. That package includes your Medicare card. So it is very important, if you are new to Medicare, to look at that material when you receive it, because it does give you important information so that you can make decisions about your Medicare coverage. Now, everyone isn't automatically enrolled in Medicare. Some people actually do have to take action in order to enroll in Medicare. So for those folks, they would have to apply for Medicare either 3 months before they turn 65. And that can be done by contacting the Social Security Administration at ssa.gov, or you can also contact them through their toll-free number. If you are retired from the railroad, then you would actually contact the local railroad retiree board in order to enroll in your Medicare. When you enroll, you'll see that Welcome to Medicare document. This is a publication that you can actually locate online. It's a CMS, Centers of Medicare and Medicaid Services publication. So that gives you information on when to apply and what decisions you need to make. And please note that the age for full Social Security retirement is actually increasing. Medicare eligibility age is still 65. Now, for some folks that have to take action, just keep in mind that could be because a person is still working and they're still employed under their employer group health plan, or they could be a spouse or beneficiary of someone that is enrolled under their employer health plan. So that's an example of someone that might need to take action, and also folks that have not applied for their Social Security because they're waiting to that full retirement age. Now, when you get your Medicare card, this is what it looks like. This is the red, white, and blue card that you want to keep in a safe place. It comes as a paper copy, one of the most important documents as a paper copy. So again, something that you definitely want to keep in a safe place. You'll notice that those of you who have been Medicare beneficiaries for a few years may have noticed that that Medicare number, or which is the number that you see on the sample card here, has changed. In years past, it was your Social Security number. If you have a Medicare card that has your Social Security number on it, you definitely want to reach out to Medicare to request a new copy because you want to have the card that has your Medicare ID number as opposed to your Social Security number. What coverage you have is shown on that card, and it showed on that card by either having Part A, which is your hospital coverage, and it will show when that coverage started, and then it will also show whether or not you have Part B medical coverage, and also when that coverage starts. So a very important document to keep. When you receive your Medicare card, you can either accept Part B, and if you accept your Part B, that's when you keep your card, and you want to carry that with you because it is an important document. If you refuse Part B, then you would just follow the instructions on the back of that card until you're ready to start your Medicare. So some people may choose to refuse Part B because they're still working and they're covered under employer coverage or group coverage. So they might want to delay Part B. There's other reasons why one might want to delay it, because if you are covered, there is a Part B monthly premium. So there may be a reason why you would want to delay starting your Part B. You notice I mentioned to keep that card handy or with you, and that is if you're using Medicare as your primary health coverage. And folks that have Medicare supplements, also known as Medigap plans, they would be folks that would typically need to have that Medicare card with them. But for those Medicare beneficiaries that are on Medicare Advantage plans, which we'll talk about in more detail as we go through the presentation, would not need to also carry that Medicare ID card with them. Anyone that has lost a card or needs a replacement, you can always visit medicare.gov/account, where you can set up or log into your secure Medicare account, and then you can print an official copy. And the other method, of course, is to contact 1-800-Medicare. Now, when to sign up or make changes to your Medicare coverage? If you don't already have Medicare, then you would make a change or sign up rather during your initial enrollment period, also known as the IEP. You can also sign up for Medicare during a special enrollment period, also known as an SEP, and that's for individuals that have certain circumstances. And then during the general enrollment period, also known as the GEP. Now, if you already have Medicare and you want to make changes in how you get your coverage, then that would be done during the open enrollment period, also known as the annual enrollment period, and that happens every year. And then you can also make changes during the Medicare Advantage open enrollment period. Or if you are in an area that offers a 5-star plan, which is the highest rated star plan that you can have with Medicare, then you can make elections outside of the other enrollment periods. And then for those that have that special enrollment period due to certain circumstances, they can make changes during the SEP. We'll actually identify a few of those enrollment periods today. Well, the initial enrollment period, again, also known as the IEP, is a 7-month period of time. It begins after you apply for Medicare. If you apply rather before you turn 65, then that coverage starts the month that you turn 65. So you'd have a 3-month period of time before your 65th birthday when you can apply. You can apply during the month that you turn 65, and then your coverage would start the next month. And then you have the opportunity to apply after the month that you turn 65, and then your coverage begins 2 to 3 months after you turn 65. If you enroll after your initial enrollment period, you may be subjected to pay a late enrollment period, or penalty rather, unless you have some type of SEP, special election period, that gives you the ability to enroll outside of your initial enrollment period. And that you also have the 6-month Medigap open enrollment period, and that starts when you are both 65 and have Part B. And we'll touch on that in more detail a little bit later. The other enrollment period that is most common is the yearly open enrollment period, also known as the AEP, because it happens annually. And that's for folks that are already on Medicare. It is a 7-week period of time. It starts October 15th, continues throughout the entire month of November, and then it ends on December 7th, and your coverage begins on January 1st. Anyone that watches any form of television will know that on October 1st, you become overwhelmed with advertisements either on television, via mail, and even the phone calls. And I would be remiss if I didn't mention that I know that you are probably, if you are a Medicare beneficiary, still even getting those calls. So this time frame during the annual enrollment period is a really busy time of year. And during that time frame, you can enroll, you can disenroll, or you can switch Medicare Advantage plans or Medicare drug plans. And again, that coverage would begin on January 1st. I do recommend for any Medicare beneficiary that during that annual enrollment period, whether you're on a Medicare supplement plan or if you're on a Medicare Advantage plan, don't let that enrollment period pass you by without reviewing your current plan benefits. Why is that important? Because every year a health plan or a prescription drug plan can make changes to their benefits. They can change providers and network. They can make formulary changes if you're on a prescription drug plan. So something that was covered this year may not be covered next year, or something that was one tier may be a higher tier the very next year. So it is important to review your benefits and make sure that you're still positioned in the plan that best meets your needs as well as your budget. That's your right. So take advantage of that time frame. If you're satisfied with the coverage that you have, then there's nothing that you need to do. It will roll over to the next year, but at least you're empowered with the ability to review. So I do, again, encourage you all to do that. Every year, your health plan should be sending you out around the end of September something known as an annual notice of change. And that's the document that will let you know what those changes are for the following year. So definitely pay attention to those and review. It is your time. Another common enrollment period is that Medicare special enrollment period, again, also known as the SEP. And folks may have an SEP for several reasons. One, if you move out of your planned service area. If you're in a plan that leaves Medicare, reduces its service area, you get an SEP. Someone that loses or has a change in their dual, which is Medicare and Medicaid status, or limited income subsidy, also known as extra help eligibility status, that gives you an SEP. A person that sent a retroactive notice of Medicare entitlement has an SEP. If you leave or lose employer or union coverage, that gives you an SEP. If you have Medicaid or Medicare or qualify for a low income subsidy, that gives you an SEP. And one that's common that a lot of folks don't know about is if you enter, live at, or leave a long-term care facility, something such as a nursing home. Those are all the things that give you an SEP. There's also more, but those are just the most common. Our second lesson, we're going to review original Medicare, Parts A, hospital insurance, as well as Part B, medical insurance. So let's focus first on Part A, which is hospital insurance. If you take a look at the diagram or the photo here, it shows you a hospital. So I always refer to hospital Part A insurance as the places. These are the buildings where a Medicare beneficiary would go to receive care. They would include such things as inpatient care in a hospital. That could be a semi-private room, the meals while you're there, general nursing, medications, as well as other hospital services and supplies, in addition to inpatient care in a skilled nursing facility, which is also known as a SNF, and that's after a related 3-day inpatient hospital stay. Part A also helps cover things like blood if you're inpatient and you need a transfusion. Covers hospice, some home health care, and then even inpatient care in religious non-medical healthcare institutions. Now, paying for Part A, most people do not pay a premium for Part A. But if you or your spouse paid FICA taxes for at least 10 years, then you, of course, don't pay. But those that do not or don't have those quarters, they may be subjected to pay for Part A. Most people are premium free. You may have a penalty if you don't enroll when you're first eligible for Part A, if you are a person that has to purchase it. That monthly premium may go up to 10%, and you'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. So with Medicare, it's always important to act on timeframes. Now, what do you pay in original Medicare? So here you'll notice hospital inpatient stays. This just shows what the amount is in 2023. Last year, an inpatient hospital stay, the deductible was $1,556. That went up to $1,600 in 2023, and that's the deductible for each benefit period. Days 1 through 6 in an inpatient hospital stay, there's a $0 coinsurance for each benefit period. But keep in mind, if you just have original Medicare, that first day in the hospital, that's going to run you $1,600. Days 61 through 90 was $389 last year, but that's gone up to $400 in 2023. And that's the coinsurance per day for each benefit period. And then if you're in the hospital days 91 and beyond, that increase has gone up to $800 in 2023. And that's the coinsurance for each lifetime reserve day after 90 days for each benefit period. Now, if you are in the hospital beyond the lifetime reserve days, you pay all costs. Mental health charges are the same. And the only difference is that 20% of the Medicare approved amount for mental health services that you get from a doctor you're responsible for. So as you can see, these are very hefty cost sharing prices when a person has original Medicare. And Medicare, unfortunately, was not designed to cover all costs. It's more of an 80-20 plan. You do have some out-of-pocket costs. And that's why folks look at things like Medicare supplements or Medigap plans, as well as Medicare Advantage plans to help with that cost sharing. You'll notice that skilled nursing stays, the first 20 days, there's no cost per benefit period. But if you're in the hospital or skilled nursing facility, rather 21 through 100 days, in 2023, that's $200 coinsurance per day for each benefit period and all costs for 101 days and beyond. Home health care is covered under Medicare at no cost to you, but there's a 20% coinsurance for durable medical equipment and then zero copay for hospice care. But you may need to pay 5% of the Medicare approved amount for inpatient respite care. Medicare doesn't cover room and board when you get hospice care in your home or another facility where you live, like a nursing home. So you can see that, again, these costs can really add up. And that's why there's protections in place to help you mitigate or manage those costs. Now, if you notice Medicare Part B, that's your medical insurance. So it covers the people. These are your doctor services. It's outpatient medical surgical services, lab tests, durable medical equipment. So these are going to be things like walkers, wheelchairs, hospital beds. Part B also covers diabetic testing equipment supplies. It covers your preventative services. So your flu shots that you get yearly, home health care is covered, and medically necessary outpatient physical and occupational therapy. That also includes speech therapy. And then outpatient mental health services are covered under Part B. But there's things that are not covered by Part A and Part B. And some of those services that are not covered is things like most dental care. So unless it's something that's medically necessary, preventative dental and comprehensive dental is not covered. Vision, so getting your prescription glasses is not covered by Medicare. Dentures aren't covered. Massage therapy, cosmetic surgery, hearing aids, things like over-the-counter items. I could continue on and on. Medicare doesn't cover everything. So some of these things a Medicare beneficiary would have to come out of pocket to pay for, or enroll in a plan that covers supplemental benefits like these mentioned here. And then there are other services that may cover those things outside of Medicare Advantage plans. Medicaid also can help with some of those costs for those that qualify. So what do you pay for your Part B monthly premium? Last year for 2022, it was $170.10. Well, this year that is decreased to $164.90. So almost about a $5 savings there. Some people who get Social Security benefits, they pay less due to the statutory hold harmless provision. And then your premium may be higher if you didn't choose Part B when you were first eligible for it, or if your income exceeds certain thresholds. But most people are paying $164.90. Part B also has a deductible. And 2022, it was $233. That decreased in 2023 to $226. So there's a savings there. And then the coinsurance for Part B services, again, Medicare wasn't designed to cover everything. So there is a 20% cost sharing for most covered services like doctor services, some preventative services. You don't pay for most preventative services, but there is coinsurance for outpatient mental health and co-payments for hospital outpatient services. Folks that have Medicare supplement, also known as Medigap plans, do get some assistance with coinsurance. And then your Medicare Advantage beneficiaries also see some cost sharing or cost savings rather when they have a Medicare Advantage plan. And then for those that can't afford to pay some of these costs, there's programs that can help, and we'll talk about that at the very end. So when you have Medicare, you have two options on how to receive your Medicare. One is to choose original Medicare. The other is a Medicare Advantage plan. And you've seen commercials that say, do you have Part C? That's a Medicare Advantage plan. With original Medicare, your Part A, hospital, is covered. Part B, medical is covered. And then you can add a prescription drug plan, Part D, and you can also add supplemental coverage, also known as Medigaps. And you could choose to also, if your former employer allows it or provides for it, to utilize that coverage, or even Medicaid. If you choose the original Medicare route, of course, you have your Part B premium that you pay unless you're getting some type of subsidy to help with it. And then you pay a premium for your Part D in addition to your copays and coinsurance. And then if you add a supplement or Medigap plan, there's going to be a premium for that. So when you choose original Medicare, you have three premiums to keep in mind: Medicare, Part D, and your Medigap plan. The Medicare Advantage route, again, also known as Part C, covers everything that original Medicare covers. So it includes your Part A, it includes your Part B, and most plans even include Part D. They provide you with some of those extra benefits that we mentioned Medicare doesn't cover, like dental, vision, over-the-counter items, and more. And some plans also include lower out-of-pocket costs. Generally, when a person chooses a Medicare Advantage plan, they only have the one premium, and that's for their Part B. So they do have some savings here. And when you're looking at the different options, I always look at original Medicare and a supplement plan as pay what you know. You know what that premium is every month, and generally you don't have co-pays or co-insurance. And when you look at a Medicare Advantage plan, you pay as you go. You don't typically have a premium for your Medicare Advantage plan or Part D. Gives you some of those extra benefits, but you do have some co-pays and co-insurance. So when looking at the decision that's best for you, think about your budget and your needs. Now, lesson 3, we'll take a look at what Medicare supplement or Medigap policies do. They're sold by private insurance companies, and they fill the gaps in original Medicare. So they cover those things like co-payments and co-insurance and deductibles. Each Medigap policy is standardized, meaning that they have the same plan letter. So that means that all Medicare supplement plans must offer the same basic benefits no matter who sells it. So if you get it from AARP United or you get it from Anthem Blue Cross Blue Shield, those letters cover the same thing. The only difference is the cost. So if you're choosing a Medicare supplement, they're going to cover the same thing based on the letter, but the cost may be different depending on the insurance company. And then in some states, plans are different. We're not in those states. So if you look at a Medigap plan and the coverage options, you'll notice they go from A to N, A, B, C, D, all kind of letters here, and you'll notice what they cover. It's a lot of information on this slide, so I'm going to focus on the most popular, which are the ones that have an asterisk beside them. We have Plan F. I always refer to Plan F as the Cadillac plan because you see that it covers everything that's located in that far left column, on down to foreign travel emergency up to 80%. It even covers the Part B deductible, which again is that $226 in 2023. But Plan F is no longer available for those that are newly eligible for Medicare on or after January 1st of 2020. If you are a Medicare beneficiary and you are on Plan F, you are grandfathered in. That is no longer available for anyone after January 1st, 2020, if they became eligible for Medicare after that date. What's popular outside of Plan F is Plan G. And you'll notice that Plan G looks very similar to Plan F. The only difference is that Part B deductible is not covered. So that $226, that Part B deductible does apply under Plan G. But after that, those other cost sharing disappear. And you notice it's 100% for everything else except for the foreign travel emergency, which is up to 80%. Plan F and Plan G, again, very similar. Only difference is the deductible. And Plan G has a very attractive rate across the board when you're looking at Medicare supplement plans. People often ask when's the best time to sign up for a Medicare supplement plan? And that is generally when you are first eligible for it. because there's no underwriting. It doesn't matter what your health conditions are, you are eligible for that Medigap or Medicare supplement plan. If you are choosing to enroll outside of your eligibility timeframe, then there are requirements where you have to qualify for that plan. And this is only referring to Medicare supplement plans. There's no medical requirements outside of the original or initial enrollment period for Medicare Advantage members. And we'll touch on that in a few. So now we'll take a look at Medicare drug coverage, also known as Part D. Part D stands for prescription drugs. It is an optional benefit available to all people with Medicare. It's also run by private insurance companies that maintain a contract with Medicare. And it's provided through Medicare drug plans, also known as PDP, which stands for Prescription Drug Plan. And it works with Original Medicare. Medicare Advantage plans also can offer drug coverage, and those plans are known as MAPD. So Medicare Advantage prescription drug plans. And then some other Medicare health plans also offer prescription drug coverage. You notice that it says it's an optional benefit. I use the word optional very lightly because if you are eligible for Part D, when you first become eligible for Part D, you should enroll in Part D. If you do not enroll in Part D when you are first eligible for it, you can be subjected to a Part D late enrollment penalty. And that penalty is 1% of the national average of a prescription drug plan for every single month that you did not enroll in a prescription drug plan for the rest of your life. So when you're first eligible, you should sign up for it. A lot of times folks say, well, I don't take medications and I could just use my discount card. We do not know what the future holds, so it's best to go ahead and sign up for that Part D plan when you are first eligible. Some people can get assistance with the penalty due to other resources that are available, which we'll touch on a little bit later. Now, how does Part D work? Notice it said optional, but again, we use that very lightly because if you join late, you will or you may have that lifetime penalty. You can choose a plan and join, and then you may pay that penalty if you join late. So you want to make sure you make a decision. Plans have formularies. Formularies are their list of covered drugs, and that includes drugs that are in they have to rather include drugs in every single category. So in other words, if you are a patient that suffers from chronic obstructive pulmonary disease, every health plan has to cover medications that treat that condition. So they have to cover every medication in each class, but they don't have to cover the medication that you're on. So you want to definitely review formularies when you're making decisions about choosing prescription drug plans. And those are subject to change, but the health plan must notify you if they're changing their formulary. Your out-of-pocket costs may be less if you use a preferred pharmacy. And a lot of people don't realize that. They might go to a Walmart pharmacy and say that Walmart pharmacy is not in their prescription drug plan's preferred network. Then you would pay a higher out-of-pocket cost to pick up medications from a non-preferred pharmacy. So you definitely want to look at that. And if you have limited income and resources, you could get extra help where Medicare will help you to pay for the cost of your prescription drug plans, or for your prescriptions rather. So again, looking at that penalty, you may have to pay more if you wait to enroll. So we can't reiterate that enough, unless you have credible drug coverage. For those veterans that are on the Zoom meeting tonight, if you are a veteran, VA coverage is considered credible drug coverage. Most employers' coverage is considered credible drug coverage. And for those that receive extra help, they're not subjected to that late enrollment penalty. Again, that penalty is 1% for each full month that you went without having credible drug coverage. And the base premium this year is $32.74. So you would multiply that by that 1% for each month. And that amount changes every year. So lesson 5, we're going to take a look at Medicare Advantage plans so that you get an overview of those. We showed this diagram earlier. Part A is your hospital, B is your medical. Most plans include prescription drug coverage. Some have extra benefits embedded in them. And most plans also include lower out-of-pocket costs. What is a Medicare Advantage Part C? It's just another way to get your Medicare, because Advantage plans have to include everything that Original Medicare includes. And it's offered by Medicare-approved private companies. They must follow all rules set by Medicare for your protection. And most Medicare Advantage plans do include prescription drug coverage, also known as Part D. In most cases, you will have to use a health care providers who participate in that plan's network. With a Medicare supplement, you don't. With an Advantage plan, you do. Now, some plans offer out-of-network coverage where you can see doctors in and out of network, but there's usually a higher cost sharing when you do so. The last thing that we're going to take a look at is help for people that have limited income and resources. There are folks that qualify for different programs, and that helps them with the cost of their medications and even the cost of their health care. Medicare Savings Program is a program that's out there for Medicare beneficiaries that need some assistance with their cost sharing. And then Extra Help is a prescription drug program. The Extra Help program is actually funded through Medicare, where they help with the cost of your prescriptions. Folks that are approved for Extra Help generally either pay no cost for their medications, no matter what tier they're on, or no more than $10.35. So if you're on tier 3 or tier 4 medication, which are going to be your brand name drugs where you might have a higher cost sharing, you will see a lower cost sharing when you have Extra Help. A lot of people qualify for Extra Help that don't qualify for Medicaid and have much higher income levels than they even anticipate will make them eligible. So I always encourage folks to look into that program to see if you do qualify. Medicaid, of course, is a program for those that have limited income and resources, and that can help with the cost of your Part B premium. It can also help with your co-insurance and co-payments. And then the Medicare Savings Program also is sponsored through the state. Medicaid's through the state savings program is paid for through the state. And that's also for those that have a little bit higher income and resources than Medicaid eligible beneficiaries, but it does help them, depending on the level that they qualify for, pay for their Part B premiums, Part A premiums if you have one, as well as co-payments and co-insurance, depending on your level. And we won't talk about the Children Health Insurance Program today for this call. So when we look at the Medicare Savings Program, this is the minimum federal eligibility requirements. So there's 4 levels: a QMB level, which stands for Qualified Medicare Beneficiary; a SLIMB level, which is Specified Low Income Beneficiary; a QI, Qualifying Individual; and a QDWI, which is Qualifying Disabled and Working Individuals. You'll notice that the column that says Individual Monthly Limits, Income Limits, this is for a single person. So you can make anywhere from $1,153 up to $4,615 per month, depending on your qualification level, which program. And then married couple limits, you'll see there. If you qualify for QMB, it pays your Part A, Part B premiums and deductibles, co-insurance, and co-payments. It's almost like having full Medicaid because it covers basically what Medicaid would cover. Part B premiums are covered under the SLIMB program. So that's a huge savings on that $164.90 a month. Same thing for the QI program. And then the QDWI program takes care of the Part A premiums only. Now, what's Extra Help? This, again, is a program that helps people pay for Medicare drug costs, also known as Low Income Subsidy, LIS. And if you have the lowest income and resources, you pay no premiums or deductible, or small or no co-payments. As I mentioned earlier, no more than $10.35 for medication. If you have slightly higher income and resources, you pay reduced deductible if your plan has one, and a very little amount in regards to your out-of-pocket. So it's more than you would pay under the full LIS program, but still a huge savings for those that have higher income and resources. And then if you qualify for Extra Help, there's no coverage gap, no late enrollment penalty if you have that program. And it also gives you one of those special election periods, which allows you to change your Medicare drug plan once per quarter in the first 3 quarters of the year, and of course during annual enrollment period. For those that are interested in applying for it, you can go to ssa.gov. You can call Social Security Administration. And if you do that application online, it literally takes 10-15 minutes. And most people find out about their approval within 2 weeks. Finally, we'll take a look at what Medicaid is. Medicaid is a program that's provided to assist with health coverage. It's joint federal and state program, helps pay for healthcare costs for people with limited income and resources, or those whose medical expenses exceed their available income. Some people qualify for Medicare and Medicaid. They're considered to be dually eligible, and then it may cover services that Medicare may not, or it could partially cover things like nursing home care, personal care, even home-based and community-based services. Medicaid provides health coverage to pregnant women, parents, children, seniors, as well as persons with disabilities. Over 84.8 million people are covered under the Medicaid program statistically as of 2021. And that number, I'm sure, has increased since. How are Medicare and Medicaid different? Look at Medicaid as aid. It's a statewide program that provides additional aid. Look at Medicare as a national program, and that's administered across the country. It's administered through the federal government, Medicaid's through the state. Medicare is generally for those 65 and older or those with certain disabilities, whereas Medicaid is based on need and financial requirements. So that's how you can really differentiate between the two. So here are some key points to remember as we close out today before we begin our Q&A. Medicare is a health insurance program. It doesn't cover all of your healthcare costs. So you do want to look at different options like Medicare supplements, Medigap plans, or Medicare Advantage plans. You do have choices in how you get your coverage. You can choose original Medicare with a supplement. You can choose Medicare Advantage plan. Keep in mind that the decisions that you do make affect the type of coverage you get. If you wait, you could have penalties. And then certain decisions, as we mentioned, are time sensitive. So you want to be cognizant of that. And there are programs for people with limited income as well as resources. So this time I am going to stop the share for just a moment and open up for any questions that you have. Just look in the chat and I don't see any questions there, but if there are any questions, I'd be happy to take those questions.
You may unmute at this time if you have a question for Ms. Carrington.
My question is, what state or what areas have that 5-star plan?
That's an exceptional question. Currently in the state of Virginia, we do have one 5-star plan, and that is through Kaiser Permanente. Kaiser is generally located in the northern part of the state. So you'll see that from Stafford County on up, Northern Virginia area. So that is a 5-star plan. In the Central Virginia area, we do not currently have a 5-star plan. There was one last year, and that was through AARP United Healthcare, but that plan has decreased to a 4.5 star. So if you're not in the northern part of the state, we don't currently have a 5-star plan that's available. Great question.
I visited the pharmacist today, and the young lady was a little disturbed that one of my meds was going to be $900. The Part D, which I have, does it typically, so she suggested that I call the insurance company. And so I'm just kind of soliciting additional advice on what this conversation might be like when I call the insurance company to see if there is some adjustment or help or.
Absolutely. I'm so glad that you brought that comment up, because this is going to be useful for many people. And that is a shock that has happened to so many Medicare beneficiaries. So there's several things that can occur in that situation. One of which is if that medication has taken you into the donut hole, also known as the coverage gap. We didn't touch on that today, but that's an important topic, because certain medications can put a Medicare beneficiary into the donut hole in the coverage gap. When that happens, the cost of your medication can dramatically increase. And that could be the case in this situation, that that particular medication has taken you into a coverage gap. A second thing that may have happened, if it's a medication that you don't normally take, and it might be one that, and this could be for anyone, one that your provider is starting you off on that you weren't on before, it could be a medication that requires a prior authorization. So if a medication requires a prior authorization, that means when the pharmacist runs that medication through the system, it's going to come back as a self-pay for that medication, because it's not covered under the health plan until that authorization has been submitted. So it'll show that you have to pay it out of pocket. Whereas if the medication was authorized, then it would be whatever cost sharing regarding the tier that that medication is on. So those are the two most common things that could happen. When you contact your health plan, the first question that you're going to want to ask them will of course give that medication. Your health plan or prescription drug plan should be able to see that the pharmacy ran the drug. So they should be able to see that it was run through the system, and they should be able to see what it is showing the cost sharing as being. They'll also be able to let you know if it was because it's hit the coverage gap, or if it's a drug that's not covered under your formulary, or if it's one that requires an authorization. So I would definitely, for everyone on this Zoom today, if you encounter that, call the health plan first before making any type of payment. Worst case scenario, if you've made a payment and it is something that should have been covered and it wasn't a part of that donut hole or coverage gap, you can be refunded when that pharmacy reruns that medication through the health plan. I hope that answered your question.
It gives me a good idea. I'm looking forward to the conversation. Thank you very much.
Very welcome.
I have one more question. I believe you said with the Medicare, we're talking about Part B, wherein preventive services are covered, but routine exams are not. Correct?
Just depends on your health plan. Anything that's considered preventative, and there's a large list of preventative services, which you can find on Medicare.gov, also in your Medicare and You booklet. Most things that are considered preventative are going to be your wellness exams, mammogram, colorectal cancer screenings, as long as they're not diagnostic. And then any like routine visit to your primary care physician is going to be considered preventative in most cases. If you're on a Medicare supplement plan, you can pretty much rest assured that that's going to be a covered service without any type of cost sharing, depending on the supplement that you're on. If you're on a Medicare Advantage plan, you definitely want to check on what that service is, just to make sure it falls into that preventative category. If it doesn't, the health plan should be able to tell you based on their evidence of coverage, whether it's preventative or if it's something that it's going to require, a procedure specific or a specialist visit. But anything that's routine, mammogram, flu shots, screenings, that's generally going to be considered to be preventative.
Okay, got it. Thank you.
Yes, ma'am. Thank you for bringing that up.
Would you say in your business, because I know you said you started in 2020, with regards to Medicare, and for those who came on late, I know you said you had over 20 years with Blue Cross Blue Shield as well. But would you say majority of your time in this space is around helping people enroll, or is it around helping people try to resolve issues because there should have been coverage or there wasn't coverage, or is it kind of split evenly on it?
Gosh, that's a fantastic question. And it's definitely split evenly. And I will say this because hopefully most of you have someone that you work with your Medicare or health coverage if you're not a Medicare and beneficiary as of yet. But it should be a combination of service as well as enrollment. So whenever you enroll in a plan, you might face issues. And that could be with authorizations if you're on a Medicare Advantage, or if you're on a Medicare supplement, you've got a prescription drug plan, maybe it's with medication coverage. I think there's a good combination of service, and that's a part of it. So from my perspective, mine is definitely 50-50.
Thank you.
Yes, sir.
I have one more question. Can you, this is regarding travel insurance. So, and it's often purchased travel insurance. Is it, from the medical standpoint, is it an addition to or redundant to the Medicare travel insurance, both domestically and internationally?
That is a fantastic question. And the answer is really going to depend on the type of coverage you have. So I'll start with Original Medicare. Original Medicare does not cover foreign travel. So anything outside the United States, then its territories are not covered by Original Medicare. So that leaves a gap. When you enroll in a Medicare supplement or a Medigap plan, those plans can have foreign travel or foreign coverage for emergency purposes outside of the US. And usually it's maybe 80% foreign travel. When you look at a Medicare Advantage plan, most Medicare Advantage plans, specifically here in our area in Central Virginia, are going to cover coverage outside of the United States. And it's for emergency services. So if you're traveling outside of the country and you experience an emergency, that health plan will pay for that emergency service. And it's generally, depending on the plan, up to $100,000. Now, mind you, you will come out of pocket and be reimbursed in those situations. So is it redundant? It really depends. I think that having that layer of security is helpful, but also, and meaning that you purchase travel insurance, but also knowing that you do have some coverage depending on the health plan that you're enrolled in for that type of coverage. If we think about travel domestically, on a Medicare supplement plan, it doesn't matter where you go, whether you're in Texas or New York City, you're going to have emergency coverage. You can see any doctor, any hospital system that accepts Medicare patients. And of course, if you experience an emergency or an urgent need, those are going to be covered. That's the same on a Medicare Advantage plan. So emergency or urgent needs are covered outside of the plan service area domestically. And then again, if we look at foreign travel, it just depends on the plan. But for peace of mind, I don't think it's hurtful to have travel insurance, but do know that you may be layering coverage.
Thank you very much.
Yes, sir. Great questions.
What's the question? Oh, hi, this is Irvin Jackson, and I'm on the verge of retiring. I got about 2 months before I retire, and so I'm trying to figure out which one should I take, the original or the Advantage plan. How much more difference on the price on original? I'm going to have G, and what else I'm gonna need for the G
Yes.
plan?
So that's a
original.
great question. G is very popular, and G is also what I would say very competitive rate wise. So with G, the only cost sharing that you'll have outside of foreign travel, because it covers 80%, is going to be with your Medicare Part B. It's the deductible. So that's that $226. So how Plan G works is once you've hit that deductible for your Part B services, then you don't pay anything out of pocket that year. On average, I would say that a Plan G can run you anywhere from, say, $120, maybe $140 per month. Could be a little bit less. This is just an average, because some companies do offer you discounts. So for example, if you choose a AARP United Healthcare plan, Plan G as an example, for AARP members, there's a discount. So you might notice that you'll have a discount with them as opposed to looking at another carrier, and then another carrier might offer their own discounts. So you want to shop around for rate, because even though Plan G is the same everywhere in regards to what's covered, pricing is not the same. Also, you will want to sign up for a Part D plan unless you have a special circumstance. Maybe you're a veteran, you don't need it. You're TRICARE for life, maybe you have different coverage, but otherwise, most people need to sign up for a Part D plan. You can anticipate that being on average $30 a month or less, just depends. So that you want to add on to your cost sharing. And then of course your Part B that you have to pay that premium, the $164.90. And then you want to look at, do you need dental? Do you need vision? Do you need that protection? Because Medicare supplement plans don't cover that. So that would be a separate policy. If you were to look, go ahead, I'm sorry.
How much is that running?
Depends on the company. So you've got several options. Everyone's probably heard of Delta Dental. There's companies called Emeritus. Humana even has dental and vision. There's many more. Those are just the first three that came to my mind. You're going to see that being on average with dental and vision, maybe about $30 to $40, depending on the company. And you'll want to check for waiting periods on the dental before making that decision. I always recommend before doing anything to meet with a licensed agent, because you don't want to make that decision alone. So it makes sense to talk with a professional that can shop around for you so that you're getting the best plan for your needs and your budget.
Yep, I already got one aboard. I'm just trying to get your opinion. What should I do? What should I ask him? What should I, say to him when he comes again? And I talked to him once. Now I'm gonna meet him with him again to try to find out which one is better for me.
Yes, and when you talk to them, also, if you're going to look at a Medicare Advantage plan, you'll want to take a look at the maximum out of pocket on that plan,
Okay.
because
All right.
that's going to be a comparison factor for you, whether you decide to go with an Advantage plan or a supplement. The best time to purchase a supplement is now, because you're eligible for it without any type of underwriting.
Thank you.
You are so welcome. Great question.
Could I clarify? I always thought that the Medicare Advantage plans basically covered you when in the state that you were in. But you are saying if you do domestic traveling from one state to the other, there's basically no difference in the coverage of a Medicare Advantage plan and a Medicare supplement plan?
That's a good question. And there are differences, but it just depends on the type of plan. So to reiterate what a supplement gives you, a supplement's going to give you that flexibility. You pay for that flexibility because you've got premiums for the supplement, the Part D plan, you pay for that freedom. But with a supplement, there is no such thing as a network. As long as that provider accepts Medicare patients, you can go to them. You don't have to look at network. You don't have to, if you're traveling, it doesn't matter as long as they accept Medicare patients. When you're dealing with a Medicare Advantage plan, it is network specific. So generally, when we look at Medicare Advantage plans, we think about HMO. We've all heard of HMO. That stands for Health Maintenance Organization. There's going to be a network with an HMO. Over the years, a lot of carriers have created national HMO networks. So that would mean that the network in Virginia is the network that you use while you're in Virginia. But if that carrier also is represented in another state, you can use the HMO network in that state. So a lot of health plans are doing that. They weren't doing that years ago, but they're doing that now. So that gives you some of that same flexibility. That provider still has to be in that carrier's network, but it's a national network in that case. Then you have Medicare Advantage plans that are called PPO. A PPO is a preferred provider organization. And what a PPO does is it gives you the flexibility of using in-network providers for the lowest cost sharing, and also giving you ability to use out-of-network providers at a higher cost sharing. So to really reiterate that question, it really just depends on what your needs are. There's a lot of health plans now that give you that flexibility. The greatest flexibility is going to be on your supplement because you don't have any network to deal with at all. But Medicare Advantage plans are giving those perks to Medicare beneficiaries so they can utilize all the benefits that a Medicare Advantage plan affords them and still have the flexibility to have a robust network even out of state. I hope that was helpful.
Yes, thank you.
Very welcome. Any other questions? Well, what I'd like to do now is just make sure that you have access to additional information. So if you do have questions and you're not currently working with a licensed agent, I'm very happy to assist you. And helping you doesn't mean that you have to enroll in a health plan. If you have questions, that's what I'm here for. My number is here, and I'll read it so that you can jot it down or take a picture. It's 804-712-6324. That's my actual cell phone number. So I answer that number 7 days a week. If you have questions, please don't hesitate to call. Even if you are working with an agent, you just want a second opinion, I'll be happy to help. I also have a brick and mortar office location, which is located in Henrico. It's at 407 East 9 Mile Road in Highland Springs, Suite E. You can reach me via email at nikki.carrington@carringtonins.com or my website, which is carringtonins.com. I've really appreciated the time with you all this evening. You had great questions, and I'm very privileged and honored to have the opportunity to speak with you all today. So again, thank you. And I'm going to turn it back over to Reverend Brown. And again, appreciate your time and attention this evening.
Thank you, Ms. Carrington. Thank all of you. And of course, if you didn't get the phone number, we can get it to you. Please call the church office. Thank you, everyone. Have a good evening.